Hi everyone, and I hope that you already joined this webinar or you will join it in a few seconds. So we will wait a couple of minutes and then we will go. So, hi one more time. Hi everyone, thank you for your time and for your interest to this topic. I'm super happy to have you here today. And as you know, the topic that we will be discussing today is about the generative AI and about the clear facts and the future trends in this area. I think that this conversation is very important due to a few topics and a few points. The first of all, because every one of you have already tried generative AI tools, you might try it for your personal needs or maybe also in regard to your professional work. And anyway, at the end of the day, all of us will implement AI tools very soon. So it's tremendously important to understand what it is generative AI, the possibilities, and also the limitation of this technology. Because, guys, it's not the magic box, so it cannot deliver everything that you might expect from it. It's just the technology, just the approach. And that's why it's very important to understand the capabilities and the limitation of the generative AI. That's number one. And number two, as you're working in the medical field, I think that if you're in 2025, you might also see some changes. You might see the interest from the executives in your medical institutions to the topic of generative AI. And some third-party providers might come to you, providing you some services in regard to the AI or generative AI tools. And it's very important to understand what to ask. It's very important to understand how exactly generative AI can be potentially implemented in your field, how you should better prepare your medical institution for the generative AI adaptation, and then to understand, as I said, where is the limitation. So how to create this safe area of the generative AI implementation. So today we will cover some topics. It's just the first webinar, that's why it will be more theoretical one. Of course, if you have any questions, you are highly welcomed to leave them under the invitation in the LinkedIn webinar. You can post them, I will see them, I will answer after my presentation to your questions. If you have any questions that you're not feeling free to share here in the chat, you're also highly welcome to pin me in the direct messages, and I will be happy to discuss your questions if it's needed also to make the call. Everything for you to understand, it's free of charge. It's my passion to share the knowledge with the medical professionals. I'm doing this for the last 10 years, working with AI in the different companies, in the different institutions, medical institutions. And I think that it's very important to share the knowledge, to share it in the easy and understandable way. And that's why it's fully for free. And it's my paying back karma to all the medical professionals who are supporting us as the patients when we come in, to your institutions. So let us start with that. Why this topic itself is very important. As I said, anyway, majority of us have already tried generative AI tools. All of us knows ChatGPT after their appearance in the late 2022. Everyone has already tried chatting with the ChatGPT or even creating some documents, and ChatGPT helps us in a lot of the different ways, mostly creative ways. But the recent surveys made, for example, in the UK and US, they show that doctors are also involving ChatGPT or the similar generative AI tools in their practice. For example, a large survey of more than 1,000 general practitioners in the UK showed that about 20% of the general practitioners using generative AI tools in their clinical work. And first of all, it's important to say that really this number is too low in this survey, and it's due to some facts that, of course, general practitioners, they might be hesitating saying that they implement already generative AI tools, or even in the completely anonymized survey, these numbers are low, and I think that it should be multiplied at least on 2 to understand the real numbers. But at least among those who responded, 29% of general practitioners using the generative AI tools to generate documentation. So it's the kind of the patient letters after the patient appointment. 28% rely on the generative AI tools to suggest differential diagnosis. So that's exactly the area where generative AI becomes more risky to use, and we will speak about it later on. And 25% of the general practitioners use generative AI tools for recommendation of their treatment options. So in these 3 different ways of using generative AI, I should definitely say that the first one to generate a documentation is the safest one from the perspective of the medical usage. Of course, data safety and the potential data leakage is also the case here, and we will speak about it later on. But when we're talking about using generative AI tools, and especially the tools like ChatGPT, for the differential diagnosis and for recommendation of the treatment options, here exactly the level of the risk is much higher in the final outcomes. Yeah, and what exactly ChatGPT will produce and how much the doctor or the medical expert will rely on these recommendations. Another study made in the US showed that around 10% of the healthcare providers use ChatGPT regularly. They're not describing in this research exactly the areas of ChatGPT usage. I think that they are similar to the one in the previous research made in the UK. But the most important that approximately 90% of those who haven't adopted or haven't used the ChatGPT in the time of this survey, they were planning to implement this technology soon for the tasks like electronic documentation on management, data entry, and appointment scheduling. So that underlines the importance of this topic, that anyway, people either using already in the medical field or planning to use it. It also underlines the important thing that when talking about the generative AI, a lot of the people still thinking about the ChatGPT as the main tool. And sharing the knowledge and understanding in the easy terms what it is ChatGPT is very important. The same is the general generative AI field. Let's talk is about if ChatGPT is a good solution itself from the technical perspective, because I'm coming more from the technical perspective. I think that it's a very good tool, and it was really a kind of the revolution in the overall development of the artificial intelligence and the computational programming. But if you're talking about the ChatGPT as the medical tool, as I said, it has a lot of the limitation. So here on this slide, you can see one of the cases that I got during the last month, so February 2025, from one of the local clinics here in Germany. They had the problem that, because you might already heard about the high burnout of the doctors in Germany, we have really the situation that the doctors are working under very high working pressure. And the young medical doctors, they need to write a lot of their patient letters. They need to write the differential diagnosis. They need to prepare these patient letters for the general practitioners. And particularly in this case, in this clinic, the young specialists were using the ChatGPT to create this patient letter. And I think that it was the process when the patient was, when the young doctor was already creating a few of the letters, and they were primarily successfully created, so maybe no problems with them. But this particular one could catch the eye of the general practitioners who were reading this patient letter. Why? Because the patient was administrated in the trauma surgery department. So the patient has the problem with the leg. And in this patient letter should be described the differential diagnosis for the trauma that this patient has got. What is stated here in this patient letter is that the patient has so-called abbreviation VAG, which ChatGPT decided to describe as the vaginal discharge sounds. This term is not applicable in the trauma diagnosis, in the trauma medicine, and it's hardly to be found anywhere in the medical documentation. So what are the problems we see here? We have the abbreviation, which is used in this particular area of medicine or this particular area of differential diagnosis. The ChatGPT doesn't understand the context. The ChatGPT doesn't have the correct understanding about the situation and how exactly this abbreviation should be described. That's why ChatGPT tries to find something that might sound plausible in this case. And that's why we have this very unique, little bit, of course, humorous case, but anyway, it's one of the possibilities to see the limitation of the ChatGPT. So if the ChatGPT doesn't know how to deal with the abbreviation or the diagnosis, then it tries to create something that will sound good. But because here the context of the situation and the output is completely different, we see how it looks like. And of course, it caught the eye of the general practitioner, and the general practitioner contacted the clinics itself where this patient letter was created. And because of this, of course, the clinics, we cooperate with this clinic right now to share the knowledge with the doctors about the usage of the ChatGPT, about the data protection, and developing the strategy which tool can be used instead of the ChatGPT to support doctors. Because it's also important to underline that it's not the case to come and say you cannot use ChatGPT, so we will leave you without any support in any tool. It's important for the medical area to understand the limitation of the ChatGPT or the similar tools, and then based on this limitation to develop the strategy which tools can be implemented instead of ChatGPT. So how we can support doctors and how to make it in the most safe way. One important disclaimer that I also forgot to add is that we will be talking today about the ChatGPT, but of course there are a lot of the others, other technologies and the other products in the chat or the generative AI tool. And the ChatGPT is one of them, but we have also Gemini from Google, we have Cloudy, we have the newcomers, DeepSeek, we have also the newcomers in this area who are coming every month. So that's why talking about the ChatGPT, you should also understand if you use any other tool, any other similar product, then the limitations and the nature will be the same. Here also a few cases to understand the ChatGPT limitations and the ChatGPT possibilities. For example, on the upper line, you see two images. One of them is the X-ray, and another one is the MRI image. And it's from the research publication where the doctors have tried the different images, the different types of information, the metadata that they have added to understand the potential and the limitations from the ChatGPT. And for example, ChatGPT 4 performed perfectly on the chest X-ray, so it has detected the pneumonia. Of course, there's some limitations. For example, without the additional information just based on the image, it was not able to differentiate between community-acquired or hospital-acquired pneumonia. And it stated that if you want to use any kind of the generative AI tools for the work with the images, of course, additional information should be added. Additional information from the patient analysis should be also added for any kind of AI tool to see the full picture. So the same as you do in your practice, the same generative AI tools should be also fed with information to get some good output. In the second case, with the MRI image, also ChatGPT performed perfectly. So the lesion was detected, it was correctly described, and the performance was really very good. And then we have in the lower line also two cases. One was with images with the different metadata, and it stated that because the sources of the images in the metadata was quite different in each case, ChatGPT provided an extremely inaccurate response, and this particular case showed the flaws in the image analysis due to the OLI on the text input. So it's also important to understand if you have, for example, the image and some kind of the text input for the same patient, the limitation of the generative AI tools that we cannot understand and we cannot wait which of the sources of the information will be more reliable for the generative AI tool like ChatGPT to make some kind of the conclusion. So the ChatGPT and the similar tools, they are more like the black box. So we feed them with the information, we get some output, but it's difficult to see through the lens how and why the ChatGPT has made this particular prediction. So they have tried the different sources of the information, the different metadata, and they saw that this flow is much the flow that the ChatGPT relied more on the text data than to the images if you feed the ChatGPT simultaneously with two types of the data. And on the last example, with the OCT images, the ChatGPT also performed not very good, and it hasn't referenced any of the morphological conditions, and the condition went undetected. Why it's happening, for example, in regard to the images with the OCT, it's because of the widespread of the images. So like in the last 5 to 10 years, there are a lot of the X-ray images and also MRI images available for the purpose of AI trainings. A lot of the research universities give the access to them. So basically you can find them more in the internet. The research and the technical community are more already had more possibility to work with these images. So we'll talk later on about how the generative AI tools like ChatGPT were trained. And it's important to understand that as much as you have these images available on the internet, the images that were already labeled or commented by someone, the better we have the chances that the tools that we are developing based on this data will be better in the prediction. If we're talking about the OCT images, they're not so widespread, they're not so good labeled labeled in the available sources like in the internet. That's why, of course, the ChatGPT performing on them more poorly. And about the text input versus the image, as it was in the third case, it's also important to understand that, yeah, text input will be, in the majority of the cases, more important for the ChatGPT than the image, because mainly it was trained on the text input. So we will talk about it later on. And it's also important to understand that AI and the Gen AI, it's also perceived as the viral hype. So, for example, these two photos from the journals was made by me, and it was just for the last week, 2 different journals that I got on the medical thema. They both had these articles, different articles about the AI for the radiology and also for the context understanding. There are a lot of the webinars, a lot of the topics happening, especially on the thing about the regulation of AI and how we can make AI more safe in the medicine. Of course, a lot of the news each week, and like everything that you see on the slide is just made. I mean, this print screen with the news, it just made the news from the last week, the news about the startups, the news about exploring how generative AI can be used in the other directions, pharma usage of generative AI, and there's one particular type of the news that I hate the most, this clickbait news. Can AI be your therapist? And that the way the study shows that ChatGPT outperforms professionals in the key areas. That's the most harmful kind of the news that can be, because from one side it's already create the negativity, the negative feeling to the generative AI tools from the doctor's side, and it creates the separation between the doctors and potential AI tools, but also it creates the overhype for the patients, because if you continuously reading this news and you continuously thinking that the ChatGPT is really performing the same level accuracy as the doctor, then you will just put there your symptoms and you will rely on any output that you will get. So you're not questioning the accuracy of the ChatGPT. That's why I really try to speak each time in any kind of the webinar about this particular type of news, that they are very harmful and you should definitely not to fall victims on both sides reading this news. With this, let us get to the topic itself. So the basic of the generative AI, in very easy terms, let us try to understand what it is the generative AI, not right now, not in the medical context, but itself. The generative AI is the type of the computer program that is trained to create the new content. Basically, it was trained, first of all, to create the text, and then create the images, the music, everything that is available right now, the videos. It's a kind of the technology that is very good when you're working in the creative areas. And this pyramid that you see on the picture is the classical evolution pyramid of the generative AI tools. For the ease to then of the understanding, imagine, I think that every one of us has faced at least once in our lifetime Q&A type of the chatbots when you chat with some kind of the services. It can be your bank, it can be, I don't know, some leisure services, and then you have some questions and you have it's like pre-programmed. So each time you enter the chat, then it will give you some possible things, like if you have the problems with your payments, click here. If you have the problems with something else, click here. So everything's pre-programmed, and these Q&A bots, they are very limited in their capabilities. Then it comes the chatbot. The chatbot has already some advanced capabilities. So, for example, you can know your name based on your personal user profile on this platform. It can extract this name, so it will say, "Hi, Anna, how are you today?" And then it will also ask you some questions based on the wording that you will use when you're answering the question of the chatbot. It will try to find the best matching answer, or if it will understand that the wording is not applicable and not connected with any kind of answer, then it will be referring you to the human, the human supporter, the human agent on this platform. Majority of the companies still working with the chatbots, but the new step in this development is exactly RAG approach. We will talk about it later on, but right now let us replace in our mind RAG with the generative AI tools like the ChatGPT. So the ChatGPT is the next step because it has quite a massive database on the back. So the database from the internet, from the different sources, and you can ask, it can generate in the human-like way of answering very profound answers. So it's like the same chatbot, but trained on the vast majority of the data, and having much more better patterns in it between the words and letters and the composition of them. Then, of course, right now comes the big topic of the AI agents and the large language models operational systems, where, like, you know, in your computer, you will have just one window where you can click, for example, I want to order the tickets to Paris, and then everything will be done without your input very quickly. So the AI agent will have access to all your programs, to your browsers, and so on. We won't talk today about agents and LLM operational system because I still think that it's early days and a lot of the concepts need to be proved here. Maybe it will be one of the topics to discuss in the other webinars. We will stop today on the level of the generative AI, and the ChatGPT is one of these tools. It's important to understand how these tools like ChatGPT were trained. So in this regard, as I said, ChatGPT was trained on the big, massive of data spread from the internet. So you might also already heard about the terabytes of the memory on the servers that Microsoft has provided for the OpenAI company to train the OpenAI product ChatGPT. So yes, that's the case. Everything that they were able to scrap from the different resources on the internet, it might be their websites, it might be the forums, it might be some research databases, everything that they were able to scrap were feed inside this model. Even the videos from the YouTube, the subtitles from this video, everything that has a kind of the text input in it were scrapped and used for the training. In this process, so the data were used for the generative pre-training, and then the basic GPT model was released. It was before 2022, so it was mainly for the technical community, for the early adopters of this technology. It was without these beautiful interfaces right now in the ChatGPT. And then, of course, the people started using this GPT model, and it's called reinforcement learning. So the people were using it, seeing the outputs, and sometimes correcting this output, sometimes not agreeing with this output. So the model was retrained based on the human input. And then we have got this famous ChatGPT that we are using right now. What is important here to underline is that because this ChatGPT and the similar tools were trained on the scrapped from the internet data, this data was not pre-selected and was not assessed from the correctness level. So you can imagine if you have in the same database the data scrapped from one side from the scientific publication, on another side from the forums. The quality and the medical correctness of the data will be quite different from these two sources, but they were feeding together inside the ChatGPT. That's one of the important things to understand about the outputs that ChatGPT can provide. It's important to have it in mind not to rely fully on the ChatGPT outputs and understand that each should be proofread. What are the limitations we have in the ChatGPT and the similar tools? First of all, of course, the lack of the context. It's easy to fall the victim of the ChatGPT because the outputs that you see sounds very plausible and it sounds very human-like. In the majority of the way, it also sounds very expert level. It's just because the ChatGPT is very good in finding the patterns in the data. So it was trained to find the best matching next word, the best matching next letter. That's why it sounds really good. And if you're asking ChatGPT about the widespread cases, where they're the cases that have a lot of the information about themselves on the internet, then the response will be quite accurate and quite good. If you will ask the ChatGPT about some cases that are not so widespread and the ChatGPT will lack some data, then of course the problem is that ChatGPT will try to generate something from its generative nature. It will come generation, so trying to find the best matching combination of the letters or the words to feel and to sound still plausible and professional. And that's why this is one of the problems that ChatGPT doesn't understand the context. It just understands how it's better to build the sentence, to feel the human-like, to feel the sentence as the human-like. That's the problem number one. Of course, right now, OpenAI and the similar companies, they're working further on, so they're adding this reasoning component. Still, it's like the testing phase for the reasoning component, and I assume that it's just the possibility to make the end users more believe in the output of the ChatGPT. But let's agree right now in this moment that ChatGPT doesn't understand the full context. It just understands the question in the way that the best matching sequences of the words will be produced based on your input. And of course, the risk of mistakes, it still has the possibility to produce incorrect or misleading information. And it's just the thing, as I said, because I try to find the best combination. But it's not, and it's also important to underline that ChatGPT was not trained as the medical product. It was not trained for the medical purposes. And I think that ChatGPT and the OpenAI has made the perfect marketing work because previously the whole medical community, like a lot of the other scientific communities, they were very skeptical about AI implementation. But right now, after the ChatGPT has arrived on the market, everyone started to think that the tool that was like generative AI tool created mostly for the some kind of the creative work can be also implemented for some very detail based cases like the medical case. And people forget because you have this strange feeling that generative AI tools, ChatGPT, for example, they give very professional answer. You fall the victim of this feeling, and you start thinking that it's really very efficient and very expert-like tool. No, guys. At the end of the day, let us one more time think very clearly that the ChatGPT and the similar tools, they're perfect for the content creation. They're really a kind of the creative tools, but they were not trained as the medical tools. Still, they can show a very good results on some medical testing. It's also the kind of the question how exactly this testing is conducting, which questions are hit, which cases are estimated by the ChatGPT. And you should also understand that it's part of the marketing game when you show these tools as the high plausible for the different cases. But ChatGPT and the similar generative AI tools have a very high risk of the mistakes. And then, of course, the possible negative effect of the outdated or the biased data. First of all, of course, OpenAI is one of the leading companies who try continuously renew and update the data and retrain the models, so they have more access and to the different sources of the data. They are more prone to be the leading company here. So if we're talking about the ChatGPT, they create the new releases. The data might be more or less up to date, but still it's not something that it's like every month. So like once a year, you will have the updated data. But of course, as I said, data can be very biased because it's not proved to be from the scientific perspective, for example, from the perspective of the possible biases in this data, like the gender biases and so on. It's not designed, these systems were not designed in this way. That's not the core thing. That's why when you put in any kind of a question, medical question inside the ChatGPT, you should also take into account that the data that were used to train this model can be outdated and it can be biased. So you should keep an eye on the output to understand. Of course, all these things, they finalized in so-called hallucinations of the generative AI models, of the ChatGPT. I think that you also have heard about this term. The hallucination mainly comes when the ChatGPT doesn't understand the context and the ChatGPT tries to find the most applicable answer that will satisfy you. And the very risky zone is that even this hallucination, sometimes this sounds very plausible for the entry-level professionals. They can sound very plausible, for example, for students or young specialists, and they can overlook them in the text, in the, for example, the example with the patient letter. That's why it's important to keep an eye on the generative AI tools and to learn medical specialists, especially the young specialists who use generative AI tools, how to assess the correctness of the generative AI tools and exactly on which cases these generative AI tools can be used. As I said, the most important generative AI tools, ChatGPT, was not designed and optimized as the medical tools. It was designed as the perfect tool to generate text by predicting word patterns, and it was not designed to verify facts and lead the diagnosis process. One more time, the possible negative effects that can be when using ChatGPT without proofreading for the medical cases can be the misdiagnosis, simply because it has no answer, because this case is outliner or some kinds of the patterns in the data are not the typical one, then it can lead to misdiagnosis. It can lead to inappropriate treatments because also it's based on the outdated data. If some kind of the new treatment, the new kind of the medicine raised on the pharma horizon during this time, it was not used in their training data. So then, of course, ChatGPT has no information about that. Then it cannot produce the correct answers here. As I said, bias, misinformation, documentational errors. And the most important that I want to underline is the over-reliance. That's the most dangerous thing that can happen because, as I said, this feeling that ChatGPT knows everything and can support you really plays a very bad game for the medical professionals. And sometimes it creates the feeling that ChatGPT knows everything. So maybe I will check one or two patient letters, maybe I will check one or two diagnoses, and then I will fully rely on it. This is a very big trap because, as I said, there can be some cases where the ChatGPT doesn't know. Then when the ChatGPT clicks on the generative feature more than on the fact-proof approach, and this over-reliance can, of course, lead to the misdiagnosis and inappropriate treatments. Another big topics about third-party generative AI tools like the ChatGPT is, of course, potential for data breaches and data safety. Not talking about the medical field, even talking about the big tech companies. They also fall victims of the using ChatGPT with some sensitive data. So the most well-known case happened in 2023 in Samsung when one of the employees has used ChatGPT to create the presentation about the financial result of the company or the sub-company, and the data was filled into the ChatGPT. Why it can be dangerous? So we're not talking right now in the case of the Samsung that there will be some hackers who will try to hack the ChatGPT and extract the data, but the reverse engineering here is quite simple. When people fill any information inside the ChatGPT, when you're asking ChatGPT to make something and fill the data for this, like the presentation, then ChatGPT use your input as one of the sources for the system retraining later on. So if Samsung had put some information about the financial result, for example, for Q3 in this sub-company, then later on, OpenAI has used the same data to retrain the system. And then with a new release, someone can come to the ChatGPT and ask, give me please the financial data for the Q3 of the sub-company of Samsung. And the ChatGPT, because it was trained already on this data, it will give exactly the needed information. So it's important to understand if you feel any kind of the sensitive data of your patient, of your medical institution inside the ChatGPT, you already agree on that this data will be used for the retraining later on. And in some cases, if someone will ask very direct questions, this data can be later on released. It's from the user perspective, of course, from the technical perspective, from the perspective of the hacker attacks, that's even more dangerous because anything still saved each of your inquiry, and then, of course, the hackers can get this information and potentially harm your medical institution or your patients. After this case with Samsung, for example, Apple has restricted employees from using ChatGPT, of course, because of the possibilities of the data leakage. So they have developed their own approach how to use the similar tools the same way. We will talk about it a little bit later. But one additional case, the newcomers, DeepSeek, for example, that arrived a few weeks ago, they have got another data breach that is not inside the usage of the model, but for example, your login details, your sign-up details that they stored on their site were already, they were found during the technical audit as the very weak protected. So everything can be hacked and your personal data can be stolen. So there are different types, as I said, different types of the possibilities how the data can be reverse engineered or the data can be hacked on these tools. It's very important. And as I said, it's very important to speak with the young professionals and anyone who try to use generative AI tools in your medical institutions about the risk, like maybe using ChatGPT is good for some cases, but guys, let's not forget about not putting any kind of the sensitive information about the proofreading and trying to make it as safe as possible. So is there any way of generative AI usage in medical field? Yes, of course. If it's made in the safe tools, if it's made in the tools that are pre-trained for the medical purposes, if you understand the limitation, if you keep in the human in the loop, then of course generative AI can be a very helpful tool for the medical field. First of all, crafting clinical notes and summaries, something that is usually take a lot of the time, this administrative work. It can be done with the ChatGPT or generative AI tools, maybe not GPT, something more safe, but something similar to ChatGPT. But as I said, it's important to keep the human in the loop, to proofread, and even if you have your own generative AI tool for that, develop, for example, especially for your medical institution, still it's important to understand it can work without the human touch. So you should prove maybe on the first rounds each time you use them, and then later on like one time per 10 records. But anyway, you still need to take a look on the output. Even the best AI model has the potential for the quality degradation. So it's important that this tool doesn't replace people, it helps people, but people should stay in the loop. Then, of course, generating patient communication templates, something that's also connected with the appointments, with the kind of the emails and so on, the easiest keys. Still, it's connected with the sensitive data of the user, so it's better to use not ChatGPT, but other tools. We'll talk about them right now, but it's a very good thing to adapt to make the communication process better. Then, of course, assisting with literature reviews and research, because working in the medical area, I understand how much you are into researching the new publications. You need to stay up to date for all the scientific information. And here exactly, the generative AI tools can be super useful. At the end of this presentation, I will show you just a few cases, exactly how the generative AI tools can be used with low or no cost at all for this. And then, of course, important medical education and training. Also a very important thing, because the new specialist coming is also was one of the cases that I was working in February. One of the clinics, they needed to educate their new staff coming to the clinic with the new insights. That's a very interesting approach when you can utilize the knowledge that you gathered in your medical practice, in your medical institutions. You can utilize them and with the help of the generative AI, make a kind of the educational program for your young specialist. Also, one important topic is the cloud-based versus on-premise generative AI tools. So the cloud-based, very quickly, it's the same ChatGPT, for example. So the tool that you can use easily, you can just download it and start using it. So you don't need any kind of the technical assistance for that. It has its pros because it's scalable and flexible, easy to use, integration with the different services. You know, ChatGPT right now provide the very different integration with the different databases and so on. But it has the concepts we have discussed, data privacy and the regulatory changes. So data privacy, you understand already, regulatory challenges, everything's connected with the GDPR or HIPAA compliance, everything of it just can't give you the right to use ChatGPT into your practice. And then, of course, on-premise generative AI tools. That's the other area. For example, OpenAI has gone more for the wide adoption. And one of the competitors, Meta, they have created Llama model. They have given the free access to this model for the technical community. So it's called open source. It means that everyone can take the same model as similar to the ChatGPT called Llama and deploy on your own cloud or your own servers. So it means that this model will be just yours. You can train it as much as you wish. You can fill it in with your own data. It will be closed, so no one will have access to your data except you. And of course, it's like in key security and control, custom implementation of this model is set training your data. And of course, the cons of this approach is it requires higher cost and maintenance. You need to have the technical team to deploy it and then to support this on-premise generative AI model, and of course scalability issues, because like if you want to make this model bigger, you will need either the bigger servers or the bigger clouds. So it will also cost you some money. But talking about the medical field and the medical implementation of generative AI, I think that on-premise generative AI tools is the only one tools that are applicable for the medical field, and the only one that can ensure, first of all, the safe usage from the data side, and the second, safe usage from the diagnosis treatment perspective, because it will be fed with your own data. You can control, you can educate based on your knowledge system or based on your electronic health record database, and it will really help you to work without the unneeded level of risk that it will be just generating something out of nowhere. So I will make additional webinar to talk more about this two possibilities, cloud-based and on-premise, showing more cases, just for you right now to understand that ChatGPT is not the only one solution. There is more a customizable solution that can be implemented into your practice. Also, very quickly about the rack approach. It's part of the on-premise, possible on-premise implementation of the generative AI tools. Rack approach is the possibility to retrain the existing model with your own database. So with this picture, you can see we have the customer put the question, and then the model, it's not generated out of nowhere, it goes to your knowledge base and search the answer from your knowledge base. Then, of course, it adds this level of the large language model, so it's not just give you the piece of the text, but it's described in the more human-like answer, but based on the information that will be retrieved from your knowledge base, and then it gives you this output. So the RAG approach and the RAG trained models are very interesting and very important concept for the medical community, for the research community. As I said, it can be coupled with electronic health records, up-to-date medical guidelines, and the knowledge databases that you will select either you already have in your medical institutions. Also, just a few words about the trends to watch in 2025. First of all, a lot of the big companies, they see the trend in the generative AI adaptation in the medical field, in the biofield, in pharma, and they try to make domain-specific models. So the most well-known among them is the MedPal model from the Google. It was initially trained as the medical tool. I highly encourage you to try. As far as I know, in the beginning 2025, it's still like you need to ask Google for the permission to try this model, but it has the medical nature, so it's designed for the medical purposes. Of course, it has some limitations. For example, you can use it as the knowledge base, but if you want connected with the electronic health records from your clinic, I still don't think that it will be a good approach, because then your data might be shared with a third party. I have nothing against Google, but preferably keeping your data on your site. So a lot of the models rising in this domain-specific way, and it's very interesting, of course, to see how they will be developing in the future. RAG-based AI assistants or RAG-based generative AI tools, as I said, there's possibility to retrieve the information from your own knowledge base, from the electronic health records on your site. It's very interesting approach. It's the most safe approach, and they developing further on. And I think that we will see a lot of the interesting tools with the RAG implementation. And of course, increased regulatory and certification efforts. You know about this hidden war of AI between the different regions of our world, and right now Europe also tried to invest more in the AI. So I think that it also somehow affects the regulation in this field, and it should be more flexible to allow more newcomers, more startups, more research institutions to develop AI models and implement them in the healthcare practice. Still, one more time, important to underline that the generative AI is the black box. that it's very difficult to regulate. It's very difficult to certificate these models because it lacks the transparency, so you cannot unbox it and see each time the prediction that was made. That's why it will be the part of the research thing in 2025, mostly for the technical community, how to make it more applicable for the unboxing, how to build the limits where we can understand exactly how exactly generative AI extract the information, retrieve, for example, the information. But currently, it's the emerging field and not applicable for specification right now. And as I promised, just a few suggestions for the research thing, because I think I see the question about the good tools that I could recommend. So first of all, I could recommend the research tools. There are three tools that I constantly use in my practice. The first one is the Research Rabbit, a great tool because then you can select the topic of your interest. And for example, you can select the name of the article that you're interested in. And these tools spot the patterns in this research publication. And then, of course, it comes very quickly finding the corresponding articles and finding the information on them. It creates also this very cool visual, like the mind map connection between your article and the similar articles, and helps you very much to research in the most efficient way the publications that you're interested in. And you can also range them from the year, so you can be very up to date. And it's like cost nothing if you don't use it very heavily. Of course, if you use it from the research institution side, then of course you might need more pro plans. But I highly encourage you just to try this tool, especially if you want to stay up to date in the research field. Then the second one is the SciSpace. Also, they have quite a different approach. You can start here with a question. So if you have some kind of the research topic that you want to get into, then you just put this question. It will find you a few articles that are more matching to your request. And then in each article, you can see the insights. You can work with this article. So it's like the ChatGPT, but more for the scientific papers. Because it was more feeded into this direction. It was designed in this direction, so it's much more better compared to the ChatGPT. It also has the free plan, so you can also try this and use it. And the third one is Elicit, very interesting approach, because then Elicit helps you to extract the most important parts of the information from the paper that you're working on or you're interested in. So it can extract the information about the population that were involved in the research, about some results, about the design of the research, and so on. And with this, you can build like the big picture of the understanding the study itself and how much it's applicable for you. I would definitely say that, for example, the tool like Elicit is very important and useful for you if you want to build the knowledge databases for the further implementation of generative AI. It can help you to find the most important information, structure it in the way, build your own database, and then later on, with the right approach, train your own generative AI models. Maybe, hopefully, with the help of your technical team, or maybe you will be, after a few webinars like that, you will be already so good technically prepared that you will do this work today. Yep, so that's all. Thank you very much for your attention. As I said, if you have any questions, please put them in the chat, or you can also contact me in the private messages. I will share this presentation. I will add it to the webinar announcement in the webinar event page. So you can feel free to use this presentation. You can feel free to share it with your colleagues and with your medical institution. As I said, as much information as we can share here to make medical specialists more understand about the generative AI, understand that it's not scary, but it's the possibility how routine work, how the medical diagnosis work, for example, can be enhanced with the help of the generative AI. It will be super important. And from my personal perspective, as the potential patient, maybe in the future, I would be already very happy if I will understand that the medical professionals using generative AI tools, but they're using it in the safe and ethical way. So my pleasure to speak here. I see here one comment. I will try to make it on the screen. Medical staff are spending too much time on administration and documentation, and ChatGPT could help saving some of this time and have more time for medical care. I fully agree with that. That's only the thing that, speaking about the ChatGPT and speaking about the administration documentation, I still don't think that the ChatGPT is the perfect tool for this, just because of the possible mistakes and the possible data leakage that can be. I think it's good to explore the ChatGPT, to explore its possibilities, to understand how exactly it can help for your medical institution, because it costs nothing to do it. But you need to be very careful when exploring it, not to share any kind of the sensitive data, to understand the limitations, and just think about the ChatGPT as the possibility of exploration, but not the final tool that you should have. If talking about the final tool, then of course it's super important to have something more safe and more profound from the perspective of the medical effectiveness. So that's why you can work with the ChatGPT very carefully. You should, of course, not doing it in the black side, as I said, like not feeding into it any kind of the sensitive data. And really let us make a few more webinars to talk more about this. And maybe after a few more webinars, you will understand that there are other ways how you can try the similar tools, but more safe tools than the ChatGPT to apply them for administrative work. So thank you very much. I think that we almost in time. As I said, if you have any further questions, please contact me. I hope that this record will be also available. So my presentation that I will share plus this record, I think that it will be useful. If you don't mind, then of course I will share with all of you the updates about upcoming webinars and the topics. I have a lot of things to discuss and to share from my side. And of course, as I said, if you have any questions, it will also help me to navigate the topics to discuss in the next webinars. Feel free to write me. I will be super happy to see you on the next events and to understand which topics might be the more important for you. Thank you very much, and I wish you a good rest of the day. Bye-bye.